In this video we will discuss about some eating disorders, and what are their symptoms. But before proceeding, if you are new on this channel or haven't subscribed Health Byte YouTube channel, do subscribe and give this video a big thumbs up to get started. Eating disorders are serious conditions, related to persistent eating behaviors that negatively impact your health, your emotions and your ability to function in important areas of life. The most common eating disorders are anorexia nervosa, bulimia nervosa and binge-eating disorder. Most eating disorders involve focusing too much on your weight, body shape and food, leading to dangerous eating behaviors. These behaviors can significantly impact your body's ability to get appropriate nutrition. Eating disorders can harm the heart, digestive system, bones, teeth and mouth, and lead to other diseases. Eating disorders often develop in the teen and young adult years, although they can develop at other ages. With treatment, you can return to healthier eating habits and sometimes reverse serious complications caused by the eating disorder. Symptoms of eating disorders. Symptoms vary, depending on the type of eating disorder. Anorexia nervosa, bulimia nervosa and binge-eating disorder are the most common eating disorders. Other eating disorders include rumination disorder and avoidant, restrictive food intake disorder. Let's discuss each in more detail. Watch this video till end. Anorexia nervosa. Anorexia nervosa is often simply called anorexia. It is a potentially life-threatening eating disorder, characterized by an abnormally low body weight, intense fear of gaining weight, and a distorted perception of weight or shape. People with anorexia use extreme efforts to control their weight and shape, which often significantly interferes with their health and life activities. When you have anorexia, you excessively limit calories or use other methods to lose weight, such as excessive exercise, using laxatives or diet aids, or vomiting after eating. Efforts to reduce your weight, even when underweight, can cause severe health problems, sometimes to the point of deadly self-starvation. Bulimia nervosa. Bulimia nervosa is commonly called bulimia. It is a serious, potentially life-threatening eating disorder. When you have bulimia, you have episodes of binging and purging that involve feeling a lack of control over your eating. Many people with bulimia also restrict their eating during the day, which often leads to more binge eating and purging. During these episodes, you typically eat a large amount of food in a short time, and then try to rid yourself of the extra calories in an unhealthy way. Because of guilt, shame and an intense fear of weight gain from overeating, you may force vomiting or you may exercise too much or use other methods, such as laxatives, to get rid of the calories. If you have bulimia, you're probably preoccupied with your weight and body shape, and may judge yourself severely and harshly for your self-perceived flaws. You may be at a normal weight or even a bit overweight. Binge eating disorder. When you have binge-eating disorder, you regularly eat too much food and feel a lack of control over your eating. You may eat quickly or eat more food than intended, even when you're not hungry, and you may continue eating even long after you're uncomfortably full. After a binge, you may feel guilty, disgusted or ashamed by your behavior, and the amount of food eaten. But you don't try to compensate for this behavior with excessive exercise or purging, as someone with bulimia or anorexia might. Embarrassment can lead to eating alone to hide your binging. A new round of binging usually occurs at least once a week. You may be normal weight, overweight or obese. Rumination disorder. Rumination disorder is repeatedly and persistently regurgitating food after eating. But it's not due to a medical condition or another eating disorder such as anorexia, bulimia or binge eating disorder. Food is brought back up into the mouth, without nausea or gagging, and regurgitation may not be intentional. Sometimes regurgitated food is rechewed and re-swallowed or spit out. The disorder may result in malnutrition, if the food is spit out or if the person eats significantly less to prevent the behavior. The occurrence of rumination disorder may be more common in infancy or in people who have an intellectual disability. Avoidant, restrictive food intake disorder. This disorder is characterized by failing to meet your minimum daily nutrition requirements because you don't have an interest in eating. You avoid food with certain sensory characteristics, such as color, texture, smell or taste, or you're concerned about the consequences of eating, such as fear of choking. Food is not avoided because of fear of gaining weight. The disorder can result in significant weight loss or failure to gain weight in childhood, as well as nutritional deficiencies that can cause health problems. When to see a doctor. An eating disorder can be difficult to manage or overcome by yourself. Eating disorders can virtually take over your life. If you're experiencing any of these problems, or if you think you may have an eating disorder, seek medical help. If you're worried that your child may have an eating disorder, contact his or her doctor to discuss your concerns. If needed, you can get a referral to a qualified mental health professional with expertise in eating disorders, or if your insurance permits it, contact an expert directly. That's it for today's video. If you've enjoyed this video, hit the like button, and don't forget to share. Also, if you are new to Health Byte, subscribe us. And to get any update from us, hit the bell icon. Take care of yourself and we will see in another amazing video.